It's actually amazing that I was anything in med device, because when you hear about how I started, I would probably have been voted least likely to succeed out of my class. I'm going to start with an unfortunately true story about my first and last on-campus interview. The year was 1998, and I knew I wanted to go into med device because I had already been rejected by like 10 biotech firms. And what was really cool at the time was biotech, but that was not going to happen for me. So a classmate of mine, Corey, told me about medical device. And there was one firm that came on campus that made the breezy. This to me was medical devices. This is high tech. This is my ticket. I'm on my way. I'm on the rocket ship. So I'm in the, and I'm sure it's much nicer now, Tenny, but I was in the 5x5 cell that was the interview room in the bowels of, probably across the courtyard. And it was going pretty well until I got hit with the question of name a profound invention of the last century. So I had a wide aperture here, anything. The car, the internet, there were a few choices. I'm realizing they probably wanted me through the wheelchair, actually, now that I'm thinking through this. So all I could think to do was panic. I had no reaction. I literally didn't think of the car, the internet, or anything. I thought of nothing except for what I had for breakfast. And I swear to God, this is a true story. I said the frozen mini, because that's the invention. It's a mini bagel. It's not a full bagel, it's a mini bagel, and that's the inventive, innovative part. So I unfortunately didn't pull it off. They were not laughing, and I was not asked back. So thank God for my friend Corey, because she had a friend that was in a legit medical device business called Guidant in Santa Clara. I was on my way. And anyway, many years later, I am the CEO of a med tech company. We are making the first new device for dialysis in 30 years. The equipment that's used for dialysis is, as you can see, I lovingly describe it as a cross between a spaceship and a mainframe computer. And that is not something you're going to walk up to and like figure it out on your own. This is our device on the left, Tableau. It is designed to enable people to do dialysis at home. So if you're going to do dialysis at home, the first thing you've got to do is get rid of this. This is called the water treatment room. These are 2,000 square feet, industrial water processing. You're not going to fit that in your house. So the first thing you've got to figure out is how are we going to purify water, make dialysate on demand, streaming during the treatment. And we have miniaturized that room into a 15-inch module. The second thing you got to figure out is it's really got to be simple. So we have set about to produce kind of the consumer product version of something very complex so that you really could enable dialysis, as I say here, to be done anytime, anywhere. I mean, this could be done at CVS. This could be done at Walmart. This could be done in the patient's home by anyone. So that kind of brings you current from humble beginnings. But what I think is more interesting as I thought about this talk is how should someone answer this question 20 years from now? So maybe our grandkids might be in that 5x5 cell. So I'm going to have to go really, really fast. But my methodology was patient impact, cost impact. What's going to be the breadth of these? How many people will these innovations affect? And then what's the depth? Is it preventative? Is it rehabilitative? That's what I mean by depth. My answers are mobility for the paralyzed, sight for the blind, contact lens diabetes monitoring, self-administered colonoscopies, and pacemakers for the brain. I'm not joking. Y'all watch and see. All right, so mobility for the paralyzed. This is real stuff. Some of it is further along than others, but I think this is so cool. This is a wearable robot. This is real. I'll try to mention company names for people who want to invest. Exo, and I have no skin in this game. Rewalk, Exo, Cyberdyne. This senses either based on center of gravity, or there's another technology where signals from the brain get processed to the muscle obviously through our nerve system, and that produces a bioelectric signal that can get picked up by a sensor on the skin. So a couple different ways to get at this, but the end result is somebody in a wheelchair is walking. There's 2.2 million people in a wheelchair, and I think 380,000 people with spinal cord injuries, and they can now walk. So this is really, really cool. I love this image of this gal walking or participating in this marathon. Okay, sight for the blind. This one's probably a little bit further behind, but it's real and it's here today, and I think this will zoom forward. companies. Second Sight is one that, that comes to mind. This is glasses that you wear. You get a retinal implant. So the image hits the camera, and then you have a pocket processor about the size of this microphone that I'm wearing. That pre-processes the image signal, sends it back to the glasses. The infrared data transmitter sends a retinal stimulation to that implant in my eye. And then over time, the brain actually learns to see the image. I mean, how amazing is that? So this one now is allowing people with zero vision to perceive light. But it's going to come a long, long way. This is going to be the standard of care. Glucose monitoring contact lens. I love this. This is being pursued by companies like Algon and Google Verily. Today, we have 30 million people with diabetes. We have 100 million people that are pre-diabetic or have diabetes. This is repeated finger sticks, day in, day out, day in, day out. So what happens is people don't do it. And so you lose control of your glucose levels, and a lot of bad things happen from there. So the current innovation of today is sensor-based. It's a patch that actually is subcutaneous, and it's measuring the glucose in your interstitial fluid. That is made by Abbott. Abbott Libre device, it's called. Really cool and on the market. The next gen is tears. You can start to monitor glucose in the tears. That part's been proven. The tough part was how do you get stretchable, pliant, flexible, wireless antenna, LED display, and all the electronic circuits on a contact lens. But nanoribbon technology is really changing this. So this is actually here. This is going to be our reality. And this will be connected to a continuous glucose pump as well. So the colonoscopy, everybody seems interested in this one. So there are 100,000 colon cancers that are diagnosed every year, and yet only 60% of us over 50 get our colonoscopy. That's a problem, but not a surprise. You can't eat, you're out for the day, you got to go under general anesthesia. It's not fun. This is a company called Exact Sciences. Their stock has gone through the roof. Very, very accurate testing. Yes, it's through the feces. Yes, you're going to be taking your own sample. Yes, it's going in that box. But if you could do a home colonoscopy and lower your risk for colon cancer, who wouldn't do that? So that's one that's here today. Exact Sciences, check it out. Last category, and then I'm almost done. The whole business of neuromodulation. I couldn't even pick from them because there's so many cool neuromod things going on, from Medtronic to a cascade of startups, sending electrical signals to the brain just as we use electrical signals to control pacing in the heart. This is being applied right now to everything from Parkinson's to depression, obesity, epilepsy, even hearing. There's a really cool little node that goes in the bone of your teeth and actually conducts hearing for the deaf. So neuromod is already here and will continue to advance and be part of the future. Now, my last comment, this is my shot at redemption. I want to re-answer the question in hopefully a better way. You be the judge. But having given this more than a millisecond of thought, my answer, I think, is fairly reasonable. It's anesthesia. So if anybody ever gets asked that question again, I'm sure you'll do a better job than I did. But you can bear anesthesia in mind and a couple of the ideas that we just talked about. But thank you so much for including me.